All right, so welcome to Your Health After 40. I'm really excited about this topic because I know it's one that we all are really paying attention to as we move forward with some health and wellness goals for the new year. So my name is Abby Horton and I am a registered nurse. I teach here at the Capstone College of Nursing and I'm a certified health and life coach, a Wellbama ambassador, and your wellness class educator. And so for today's class, we really want to talk about common health concerns for individuals over the age of 40. And this can be important even if you're just approaching 40 because we really like to think about health being proactive. And so we want to discuss the importance of health screenings for individuals over 40 and talk about useful strategies for effective weight loss and health management. We also want to identify ways to stay healthy and fit. So before we move on, I'm going to just check the chat and see, are we automated? It's not giving me that option. Ashley, can you help Bridget? I'm not quite sure what the question is. Okay, and thanks. Yes, happy to be here. So before we talk about some of the health topics, I really want to talk about our mindset around midlife and even those of us who may be, not approaching midlife yet, or those of us who are beyond midlife. When we think about the new year, mindset can be so important. And so to pause, reflect, and reset is something that I am in the practice of, and I hope I can encourage you to start doing that as well. So Dr. Brene Brown is a well-known social worker who does a lot of research around mindset and mental health. And she talks about midlife being a point where we really need to stop and pause and reflect and be really intentional about making some good choices. And so she says, it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open everything back up to heal the hurt. And so this is one excerpt from a book and a work that she talks about when midlife approaches. We start to have, times where we, are having to make choices. Do we want to continue on the path that we're on, or do we want to make some good changes? And so we're going to talk a lot about mindset and habit change around the topics that we're talking about today. And so she says that midlife is not a crisis, but it's an unraveling. And when she talks about this, she means that we really start to become closer to our authentic selves, and we start to really make determinations about the things that we want to continue in the second half of our life. And so I hope that you can take that positive mindset moving forward with this content, because there's always an opportunity to grow and improve for all of us. There's always an opportunity to make healthier choices. And so it's not about being perfect, it's about progress, and it's about being intentional with the choices that we make. And you're obviously doing the work to make those choices, or you would not be here during such a busy time wanting to really grow in your health and wellness. And so we want to commend you for that commitment. So, common health concerns over the age of 40. We think about chronic pain, we think about arthritis and back pain, which is the most common pain that we really see in the US. We think about joint health and tendinitis and bone health with osteoporosis. Of course, stress, and that can be acute or chronic stress. We think about mental health challenges like depression and anxiety. We think about heart or cardiovascular health. We've already had someone mention blood pressure, which is a huge concern for most Americans. Cholesterol, which is another one that we, really can focus on. And I'll go ahead and put a plug in that we have a cardiovascular health talk. So if you are really interested in cardiovascular health, things like your cholesterol, your triglycerides, your blood pressure, and just your overall heart health, we have a talk on our wellness.ua.edu page where we have our archived webinars, and I have an hour-long talk that just talks about those things. And so I would really encourage you to check that out. I also have one on habit change that I think you might really enjoy too. So those are some plugs for some webinars we've got posted for y'all. We can think about changes in our heart rate. Inflammation is certainly a concern because of all of the processed foods that we eat and the chemical exposures that we have. We think about communicable diseases, of course, with COVID-19, that is at the forefront of all of our minds. We think about changes in our blood glucose, and that can be, that our blood sugar is raised and elevated, but it also can mean that it fluctuates. So you can have, dips and elevations in your blood sugar, which can cause a lot of problems for you. And it also can cause some anxiety. And so we're going to talk about how all of those things relate. Of course, body mass index usually changes. We can have skin cancer and other skin concerns that kind of, crop up as we start to age. Changes in our hearing or our visual acuity, of course, we, think about those quite a bit with aging. Hormonal changes and lifestyle changes that impact us. And then, of course, just our overall mental health. And so those are some of the things that we often see. I'm going to check the chat because I saw some activity there. Okay. Bridget, that you're muted. Okay, you should be able to unmute, but if not, just let me know and we can try to help you with that. And hopefully you can hear me. That you can't see all the participants. It may be that y'all are in the webinar format. Typically ours are done via meetings, but this may be a webinar format for today. You can hear, but you cannot use your microphone. Okay, Ashley is on here today, Ashley Bowman, and so she's helping manage the chat, and hopefully she'll be able to pop in. Yes, it's a webinar, so that's why you can't see her here. But you can raise your hand, right, and you can pop your questions in the chat or the Q&A. Thanks, Ashley, for helping out. So sometimes we're in meeting style and sometimes we're in webinar style, and it just depends on the needs of the office. So sorry about that. And so screening and prevention is really going to be key to healthy living. And so when we talk about knowing your numbers, we really want you to know your health numbers. So whether it's your BMI or, whether it's your, blood sugar or your blood pressure or any of the other numbers that we talk about today, really having a baseline and knowing what your numbers are will give you a benchmark for improvement. And so anytime we're going to make a change, sitting down and reflecting on what your goals are, what your needs are, and what your numbers are will really give you a guideline for what improvements that you need to make, if any. And so we really want you to focus on just using the information that you get today and that you get in the WellBama programming that we have in the WellBama screenings for you, using that information as just data. And so oftentimes when we get our numbers, if we step on the scale and we don't like what we see, or if we get a number back and it shows that we have high blood pressure or high cholesterol. So oftentimes we can really let that impact our mindset, and we can get discouraged by it because we associate, negative feelings or emotions with those, especially for people around weight. This is particularly true for women, although it does impact men as well. When we step on the scale, we can let that really define how we feel about ourselves. And so there are a lot of things that are tied up in how we view our health and how we see our health. And so we just want to encourage you to use the numbers and the metrics that we're talking about as guideposts on your health and wellness journey, and to just use it as information, as data, and not to get caught up in, feeling overwhelmed or feeling, discouraged or disappointed because a number may not be where you want it to be, or it may not be in a healthy range. And so screening and prevention is really the key to healthy living, and it starts with knowing those numbers. So we are so fortunate to have the WellBama program and screening available to you as a UA employee, where you can really get numbers related to your heart health, your cholesterol, your blood glucose or blood sugar, knowing your health risk, your blood pressure, your triglycerides, your BMI, and your activity levels. Those can all be, measured at a WellBama screening and can give you a good starting point for where you need to make changes and improvements. The very end of our talk, I'm going to tell you about life and health coaching that we have available through the office. of wellness and work life, where you can actually sign up for an appointment that's completely free with me to do some of this work around, setting good goals and starting your health and wellness journey. And so if that interests you, I'll have my contact information available so that you can reach out for one of those appointments. But taking this information is going to be the great first step that you need in terms of getting a handle on your, on your numbers and on your wellness goals. So when we have annual physical exams, beyond what we can do for you here with a Wellbama screening, we really encourage you to have an annual physical exam. And so if you don't have a medical home where you have a physician or care provider that is regularly monitoring your health and, has formed that relationship with you, so that you have a good baseline and a good working relationship, we really encourage you to have a medical home. So, a primary care provider, usually that's an MD, but that could be a nurse practitioner. We want to make sure that you have somewhere that you can go and get a routine physical exam, at least on a yearly basis. And so they can screen you for medical issues. They can look at your risk for future medical issues based on your own medical health and your family history. We want to encourage you to have a healthy lifestyle, and that certainly can be supported through Wellbama programming, but also through, this medical home that you can have. Make sure that you're updated on your immunizations, which is even, more, important and relevant and timely now because of COVID-19. And then it just really helps you build a relationship with your primary care provider, whether that's an MD or whether that's a nurse practitioner. So when you go for your annual physical exam, we always encourage you to have lab work, and most physicians and nurse practitioners are going to do that routinely. But some of the things that we like to highlight are, having that routine blood work, but also a dental exam and cleaning. Many times people don't take advantage of the dental exams or maybe don't opt for the dental care. And that's so important, particularly as we age or as we have lifestyle changes like, pregnancy or hormonal changes that naturally happen as we age. But having 2 cleanings a year, and at least, one set of x-rays typically every year is very helpful for your dental health. And we know that our dental health really is connected to our overall health. And that did not used to be, kind of the going, assumption about dental health. It was more, seen as an aesthetics thing that, that you're just making sure you have pretty teeth. But really, our dental health and our gum health determines a lot of our overall health, particularly with our cardiovascular health. And so that's important to really prioritize. You want to have those 2 dental checks a year at least. And then hearing screenings are not something that we see people promote a lot in healthcare, but it's so important to really know your numbers when it comes to hearing screens. We talk about vision a lot, and vision is important. We talk about 20/20, but there's also a 20/20 campaign with hearing, and so I'm going to talk about that a little bit later as well. But if you're having difficulty, particularly now that many people are having to wear, face coverings and masks and be out and about with those on, and you're regularly interacting with people with their mouth being covered. If you're having difficulty with picking up on the conversation or following the conversation or hearing the conversation, it may be that you have some hearing impairment that you haven't been, really aware of, and you've been compensating by actually reading lips. And so if you notice that you're having more difficulty, it could be that there's a hearing impairment that you've just really naturally compensated for, and it's becoming more apparent now that, social norms have changed and you're not able to see people's mouths and not pick up on those, cues from facial expressions, reading lips, or, the mask is actually muffling the sounds. That could be something that you really need to check into with your ENT. So that's an ear, nose, or throat doctor, or, an audiologist, which many ENT practices will have an audiologist that can do a hearing screen for you. A comprehensive eye exam with pupil dilation is so important. So many people use an optometrist for their reading glasses or prescription glasses, and that's great. That's a great service, but it's also good, especially once you're approaching midlife, to have an optometrist an ophthalmologist so that you can have an actual pupil dilation, so that you can make sure that your vessels are good and healthy, and that you're not having any sort of issue with, glaucoma, which is high ocular pressure, that you're not having any kind of blood vessel issues. And this is all very particularly important if you have diabetes or any other chronic illnesses. You want to make sure that your eye health is really well taken care of and maintained. You also want to make sure that your skin and that, your moles are regularly checked, particularly if you've ever had an abnormality with your skin or moles. And that can be checked with a primary care provider, but also with a dermatologist if you have a higher risk factor. Blood pressure screenings and cholesterol checks are really important, particularly at midlife. I go into more detail in the cardiovascular talk, but I would just want to, make note that we talk about blood pressure being a quote unquote silent killer. But blood pressure, when it's elevated, you actually do have some signs and symptoms of that. You can have brain fog, you can have headaches, you can feel dizzy, and just overall not feel well. But when you have high cholesterol, you often really do not have any symptoms. There's nothing noticeable that changes. And so I would say that cholesterol is really the silent killer because blood pressure does have signs and symptoms. We just don't often really attune to those. And so you'll often see cholesterol is elevated with blood pressure, but you're typically diagnosed with high blood pressure first, and then they do blood work and see that your cholesterol is raised. But typically what actually happens is your cholesterol raises first, but it's not the canary in the mine, it's the blood pressure, because you eventually get headaches and you go to the doctor, or you go for a screening and you see that your blood pressure is high. But cholesterol is usually the first thing to be elevated, and then blood pressure follows. And in that talk that I've referenced, I actually go into the reasons for why that is. But cholesterol raising is actually what typically blocks the arteries and vessels, and that raises the blood pressure. And so you want to make sure that you're keeping a check on your cholesterol. Because we have so much, processed foods on the market, even healthy options have a lot of added, sugars and salts and things. You really want to make sure that you're keeping your cholesterol checked, because most people do have elevated cholesterol once you're into adulthood. And we're even seeing children as young as elementary school age actually deal with high cholesterol now. And so that's really, really important. Diabetes screenings are really, vital to our overall health, because you can have so many complications with diabetes. And we do have a high-fat, high-sugar diet in the U.S. It's called the SAD diet because it's the standard American diet, which is highly processed. And so you will see, diabetes be a concern once you start to approach midlife, because you can have other risk factors that make you more likely to develop some issues with your sugar. And then having a baseline EKG, that's something that you may or may not need. If you have risk factors or you've ever had a personal issue with your cardiovascular health, an EKG may be appropriate, but you're not going to see someone routinely order that for you. But it is one of those, benchmarks for you to have a good baseline EKG. So if you do have changes in your heart rhythm over time, you have a baseline to go back and see that there has been a change. And then thyroid health is important because we're exposed to so many chemicals today and so much processed food that impacts our thyroid. For people who are gluten sensitive and have, things like irritable bowel syndrome or other issues with gluten, you can often see that they have issues with their thyroid as well. And so all of these things will impact the other. So if you have one, health concern, there may be others that you need to keep a check on, because our bodies work together. And so if you are having some thyroid issues, you definitely want to make sure if you're experiencing fatigue or you're having, an enlarged thyroid or things like that, that you have a thyroid check. And there are many things that you can do, like having an ultrasound, but even just having your practitioner palpate or touch your thyroid to make sure it's not enlarged. It's something that can be done on an annual exam. And it's a good way to screen to see if you have any noticeable nodules or enlargement in your thyroid that might warrant further, workups to make sure that your levels are good and that you don't have any, issues at the actual thyroid itself. So blood work and that, exam can be really, really impactful. Women tend to have more autoimmune conditions, and there's definitely autoimmune components to all of the things we've mentioned. And so that's important to note as well, because so many times autoimmune conditions are actually invisible and we don't see the signs and symptoms of those until it's progressed to something else. And so that can be important for you to check as well. Immunizations, of course, are really important now more than ever. And so, flu vaccinations, shingles, tetanus booster, the pneumococcal or the vaccine that helps prevent pneumonia, hepatitis, and then, of course, the rollout of COVID-19, which we expect to happen in 2021. Those are all, immunizations that you could, foresee having to have or have a booster of once you're approaching, midlife. And so for the pneumonia vaccine, that's typically only going to be once you start to reach, your early 60s or, somewhere along there, unless you have other risk factors. And so that's why I say as recommended. For the shingles vaccination too, those recommendations are going to start to change once we see people who've actually had the chickenpox vaccination start to age. And so some of these recommendations are really going to be ongoing and updated based on the age group that we're talking about because of the way those vaccinations and immunity work. But these are the ones that we typically think about being important. We also want to mention the colorectal cancer screening. Unless you have a high risk factor for this cancer, it's probably going to be age 50 when you start to have that screening done, and a colonoscopy every 10 years. And so that's something that at age 50 you're going to really want to think about with your practitioner. You also can do something called a fecal occult blood test, or you can do the immune chemical test, which would rule out some screening things that you would need to do because colon cancer is one of those that is a little bit more difficult to detect and something that we like to tell people about just so that that's on their radar. So some other healthcare recommendations, when we think about screenings for women and men, it's really about the hormones that you have on board, because hormonal factors do play a role in many of the healthcare concerns that we can have. And so that's why we, pull this out into male and female. It's really about the hormones that you have on board. So just keep that in mind. But having a clinical breast exam is important, not only for women, but also for men. Men can have breast cancer. We have the same tissue. We just have more or less of it, and we have, hormones that act on the tissue differently, but men can have breast cancer. So it's important that, men and women, although it's not listed here, for you to actually check on that. We're probably not going to have a clinical breast exam unless you notice something for men, but you want to make sure that for both, you're checking to make sure that you don't have any lumps or tenderness or masses or things. And certainly you can actually see lymph nodes that are enlarged near the breast tissue. That is not uncommon, especially for young women. But it's important that when you're doing your, self breast exam every month, you want to make sure that you're doing it after your monthly cycle. Or well before your monthly cycle, so that the tenderness that you're experiencing or some of the hormonal changes that can happen in the breast tissue aren't related to your cycle. And so there's lots of information online about how to do it, but there's a lawnmower method for how you make sure that you, do your hands up and down across all the breast tissue, and then also a circular motion, how you raise and lift your arm. There's lots of great information out there about how to do that exam, but it's important to do, and you might just want to set a reminder on your phone to actually check. It's not usually difficult to feel that there's something that's out of place, but you might not know if you've never done an exam before, so that's important. Around 40 is when you start to get a mammogram. Before 40, you can have dense breast tissue, which makes it really difficult to actually get an accurate mammogram. Many young women, because of hormonal changes, do have that thicker breast tissue, so you're not going to be able to see things on a mammogram like you would once you age. And so that's important to know. Having a pelvic exam, a pap smear, and then a bone density test as recommended are all really important for women. Women access the healthcare system between ages 15 and 44, which are considered to be the quote unquote childbearing years, for reproductive health more than any other medical services that we have. And so I think that's important to note because we don't often talk about reproductive health. And certainly, even if, during that time frame, women are not always choosing to have children, but reproductive health is still important, and it's important to actually go and have those exams and those screenings done because of the hormonal changes that can impact you, whether you choose to have a child or a pregnancy or not. That can be very, very important. And so I just want to highlight that because we don't often hear that in the conversation around women's health. Additional screenings for men, of course, having an annual testicular exam. You can also do that as a monthly self-exam. And you're looking for any, changes in size or shape, or, you're looking for masses, lumps, and tenderness. Or anything that's unusual, which I think is important to note, because if you've seen a change, even if it's not something that I've mentioned, a change could mean that there might be something that needs to be followed up on. And then a prostate screening can be really important for men's health as well. And you're typically going to see that around this midlife age because the prostate does enlarge over time. And so back to the hormonal changes that you can see, a concern for women in particular would be a menopause change. So premenopause just means that you're not near the age of being in menopause. And so perimenopause means around the time of starting menopause, which is usually 40s or 50s in the US. It's much later in life in other parts of the world. But the more developed parts of the world, it doesn't seemingly make sense, but I'm going to tell you why this is true. The more developed the world, the country is, then the environment, you're going to see people start menopause earlier. And that's because of all of those exposures that we have. It's also partially probably because of, just having access to being able to diagnose that. But part of it is the exposures that we have in an industrial world and society. And then postmenopause, of course, is after that, change in hormones. So typically we define hormonal changes with menopause as being no cycle for a year. And even you can still have some spotting and things like that. And the average age is around 51 years old. But we do see women in their early to mid 40s starting to have these hormonal changes. Symptoms, of course, include hot flashes and lots of other physical changes, from vaginal dryness to decreased libido, can impact, your concentration. You can have brain fog. You can have insomnia, difficulty sleeping, hair loss, weight gain, and you can even see an increase in metabolic syndrome, which is, where you're having high blood pressure, high cholesterol, and high blood sugar. And that can put you at increased risk of developing some issues cardiovascularly. And so it's important that if you start to notice changes that you seek help, because there are things that can do a lot of good with managing your symptoms and even alleviating some of those. We think about these things as being, normal, quote unquote, or expected symptoms of menopause, but typically around the world, we see women who transition through these hormonal changes with many less symptoms. And so there are things with diet and exercise and lifestyle changes that we can do so that we aren't experiencing all of these side effects of this hormonal change. Men also have a type of hormonal change that we don't often talk about. Rather than calling it menopause, a lot of times people will refer to this time as a midlife crisis, because we can be very gendered in our language around healthcare. I think it's important to note, because after age 40, you can actually see a drop in testosterone for men. And that can impact some of the things that are typically seen as being midlife crisis behavior. And so testosterone levels typically drop 1 to 3% a year beginning at age 40. So that's a pretty significant decrease over 10 years in your testosterone levels, which are really needed for men to be able to function at the level that, you know, that doesn't impact their activities of daily living. So of course, they think about decreased libido and hair loss and fatigue, but you can have mood changes. You can have loss of muscle mass, increased body fat, particularly around the abdomen, which is also true for women. You can have bone health issues, memory issues that, you know, of course, are going to be impacted with the mood change, lack of motivation and depression, which, you know, those are some of the things that we think of, you know, the stereotypical midlife crisis. You can have elevated blood sugar, which elevates the, you know, HA1C, which is that longer measurement of blood sugar. You can even have things like anemia. And so if you see a middle-aged man with anemia, the first thing I think about is checking testosterone levels. You can also have other, you know, sexual health issues as well, which are, you know, things that we need to really address because that can impact your overall health and well-being as well. So lots of things that can be going on that we don't often think about as a hormonal change for men. So, and very important to talk about. So weight loss over 40, why is it so hard? You probably have an idea of why it's hard after listening to those first, you know, few slides on the hormonal changes. And that is one of the reasons. We have decreased digestive capability, decreased metabolism at times. And we also have a decreased growth rate in the cells in our body. And so our body is just having to work a little bit harder to do all of the maintenance. And we can have lifestyle changes. This could be stress. Certainly stress can impact you know, our cortisol levels, which is going to impact all of our other hormones that impact our metabolism and our appetite. And we can have weight loss resistance because of some of these changes that happen across the body systems. And so that's why it can be so hard. We also usually have a lot going on as we're in midlife. And so it's important for you to really think about all of the different components and not just that, you know, it's calories in, calories out, move your body. There is more to health and weight loss than that. So this is just kind of a reference point for you of activity level and the pounds that you currently weigh and the calories that you might need. But always use these tools as just tools and guidelines because everyone is different. I really subscribe to the notion of bio-individuality, that, you know, there are certain things that are true for most of us, but, you know, we are all unique individuals. And so what works for me may not work for you. And so it's important that you find what works for you and just use this information as an educational and, you know, resource tool versus me giving you kind of this prescribed protocol to try. Some wellness basics that I like to start with, which is why I put the start here pin, you know, it's kind of like your map of where do I start with health and wellness. And I would say, regardless of where you're starting from, regardless of the health challenge or, you know, the goal that you have around your health and wellness, if you start with these 5 to thrive, you'll be in a really good place of, you know, building a foundation of health. And so sleeping well, aiming for 7 to 8 hours of sleep, that's great. But you also want to think about not just the quantity of hours, but the quality of hours. So making sure that you're, you know, having a nightly routine, you know, kind of a power down hour where you're putting away your electronics and you're, you know, limiting or reducing your, you know, blue light exposure. You're, you know, changing the settings on your devices, you're putting your devices away, you're wearing blue light blocking glasses, you're doing the same routine every night. You know, all the things that we know to do for young children to get them to go to sleep, we abandon those in adulthood, but we would really benefit from those as well. You know, doing those kinds of things, making sure that you're in bed by 10 because that matches your, you know, circadian rhythms of getting good restorative sleep. You know, making sure that your room is cool and dark and quiet. Those are all really important things. And I would say, for me personally, for sure, quality of sleep is more important than the number of hours that I get. But we don't often talk about that in our conversation around sleep hygiene. Staying hydrated is so important, particularly for those of us who talk for a living. On days where I teach, I am much more dehydrated than on days where I don't have to talk a lot. And so drinking about half of your body weight in ounces a day is a good recommendation. And that's typically more than the 64 ounces that we typically recommend. So we usually say 8 ounce glasses of water, which is 64 ounces. But most people do better at the half your body weight in ounces. And that's usually, capping out at around 100 ounces. For some people, especially those of us who weigh more or those of us who exercise more or have more issues with maintaining hydration, you could even go up to as much as 128 ounces. But you really want to track your water and how you feel, because that's going to really determine how much water you need. And to recognize, it's so important that you might need 64 ounces today and you might need 100 ounces tomorrow. So listen to your body's cues and make sure that when you're feeling hungry that you're not actually thirsty, because our brain really has a difficult time determining whether we're thirsty or we're hungry. And we usually get the cue that we're hungry for both. And so if you think that you're eating more than you typically would and your water hasn't been where it should be, then try to drink water and wait about 15 minutes and see if you're still hungry, because oftentimes you're not. And so we like to say water first, veggies most. And so if not, then try to get a healthy veggie snack after and see if that cures the hunger pains. Now, if you haven't eaten, maybe you just need to take a break and eat. So definitely use what works for you, but those are some good tips to start that process. And then you want to strive for a healthy plate. So you want to say that half of your plate is vegetables. And I know that's different than what the My Plate guidelines say, but a more plant-based diet is really helpful for most people. But you do want to make sure that you are having, whether you eat meat or you don't, that you have a good protein, a good complex carbohydrate, and a good healthy fat at every meal, because that's going to help sustain your blood sugar so that you don't have the dips and the elevations in it. And when we have those dips and elevations, that causes a real stress on our body. And so that's difficult for us. When our blood sugar is erratic, then we can even have a physiological induced anxiety because our blood sugar is lowering and raising so rapidly. And our standard American diet really promotes the blood sugar instability that we see, which is why we have so much diabetes now. I also want to encourage you to eat the rainbow. Oftentimes we only eat beige or green foods. So you kind of see that represented here in this picture. If we're healthy, we'll eat something green, but most of our food's beige. Think about the potatoes that you eat. The proteins that you eat are usually beige. That's really what our plate consists of. So I'd really encourage you to think about how colorful your plate can be, because each of those colors in the fruits and vegetables that you eat represent a different group of vitamins, minerals, nutrients, antioxidants that you need to be healthy. And so you want the reds, the greens, the purples, the blues, the blueberries. You want all of the range, the oranges, because that's going to mean that you're getting the full nutrients that you need. And it's estimated that between 90 and 94% of American adults are actually undernourished. And so, you think about, well, how can you be undernourished when there's an obesity epidemic in this country? And it's because we're eating a lot of calories, and so we're gaining a lot of weight, but we are not getting the nutrients we need because the food is so processed. And so that's important to note. You want to move your body every day, and that doesn't mean formal exercise, but that just means that you're doing more movement than you typically would. So you're doing something intentional that is beyond what you would do just in your day-to-day life. And so that might be, a dance party in your kitchen. That might be walking your dog after dinner. It could be, playing a game of basketball with your kids, whatever it is for you. But it's just important to move your body every day. Ideally, we would like to see you exercising 3 to 4 or 4 to 5 times. You'll hear both ranges a week. for 30 minutes to get your, heart rate up and have that good cardio. We call exercise, cardio or strength training, and strength training is really important after midlife. But I always recommend, if you're going to lift weights for strength training, that you work with a fitness trainer so that you learn the proper technique so that you're not prone to injuries. And we have a lot of great resources at the rec center to get you help with that. But cardio, we shorten the name of that, but that's cardiovascular exercise. And so anytime you're doing something that has cardio, you're doing really good work for your heart, your cardiovascular system. And so that's important as well. And then meditation is so important. Sometimes meditation can feel inaccessible because we think about it being something where, we're doing yoga and we're sitting on the floor, and we're doing it for long periods of time. But meditation can simply be sitting in your office chair or your parked car or on your couch or on your back porch and just, having some peace and quiet for 3 to 5 minutes. It's not the elimination of thoughts. It's just that you're letting your brain rest. And so I always say, and this is not backed by research, but I always say that meditation is for your mind what sleep is for the body, because your mind really does need breaks every once in a while. And we sometimes hit the alarm clock, in the morning to cut it off. And then we're just go, go, go until we go to bed at night. And we wonder why we have so many sleep issues. And it's because we don't stop to take breaks. So if you can start doing 3 to 5 minutes of meditation in the morning and then do it and again in the afternoon and then again in the evening, I really think, if you did that, that'd be 15 minutes of your day. And we all have 15 minutes. And if you don't feel like you have 15 minutes, then you are the very one that we need to do the meditation, because I was that person that said, I don't have time for that. And I benefited the most from it because I needed that break and I was more productive after. So if you struggle with giving yourself permission to do some of these things and do some of the self-care, then please let me tell you, you have permission. You need to do these things for yourself so that you can prioritize your well-being, and you'll really benefit, and those around you will benefit from that as well. So meditation can feel difficult to start. So if you are challenged with it, you might just start by closing your eyes in the morning for a few minutes. You might use an app. There's so many out there that I love. I like to use the one called Calm or Headspace or My Life, and you can get free versions of those. And that's a great way to get started, especially if you have a difficult time kind of shutting off your brain and you think about things a lot. Those can be really helpful because they have guided meditations. So overcoming some changes in, and some challenges with weight management, you want to adjust your eating habits. You might need to look at your calorie intake. You want to make sure, like I mentioned, to avoid the peaks and valleys of your blood sugar, because that's going to cause fatigue and hunger and possibly anxiety. You want to make sure that you're really, acknowledging your body's, biological rhythms and adjusted them. I'm a night owl, and so much of what is told, and recommended in the health and wellness field does not really resonate with me, because that really promotes you being an early riser and, getting up and getting your exercise done and having a big hearty breakfast early in the morning. And that doesn't work well for me. And so I had to adjust my expectation, and that might be something you need to do as well. You want to make sure that you, really think about your calories, if that's not triggering for you. For some people it is. But you want to make sure that you recognize that just small changes in your calories, for the positive or the not so positive, can really make a big impact on your overall weight. Just having an extra Coke a day can really impact your weight. And so think about that as you're making changes. And then you want to make sure that you're actually addressing any underlying medical conditions that you might have that you might not know about. And so that's why these health checks and screenings are so important. Thyroid problems affect 1 in 5 adults over the age of 40. And I would imagine it's probably even, more like 1 in 4. I think that we really don't diagnose a lot of autoimmune and thyroid issues in folks. And so I would say that it might actually be higher. And so some of the things you can do is to boost your metabolism with nutrient-rich foods. So like eating the rainbow, that would be really helpful. Your metabolism will improve with the water intake. So improving your water intake would be a great step. Monitoring your calories, but also monitoring how much you're expending of those calories. Avoiding empty calories like soft drinks. I know for me, I can eat a really good meal, but I oftentimes really like to drink my calories in the forms of soft drinks or other kinds of teas and things, coffees. And so that's something that when I started my health and wellness journey, I had to really be particular about making sure I didn't drink those empty calories because I wasn't really getting nutrients from that. That made a huge difference in my, weight loss and in my health. And I've seen that for others as well. So that may be something you want to work on. Hydration is really important to the overall well-being. And like I said, if you're someone who likes coffees, teas, soft drinks, juices and things like that, work on adding in more water. And the more water you add in, the less room you'll have for those Cokes and things. If you try to eliminate the Cokes and drinks and other things like that, that is, our brains don't like to subtract. We like to add. And so you may end up having a hard time getting rid of those extra, sugary drinks and things. So try that as a tactic. Increase your fat burning ability with things like high intensity interval training or strength training, which can be really good for your bone and muscle health. And then, like I said, move your body every day. So think about what's the best time for you to work out. Like I said, we always want to say to work out early in the morning, but that might not be the best time for you. So think about when you feel the most energized or motivated and schedule in your workouts then. I actually can sometimes work out in the evenings, and that's usually not recommended because you don't want it to affect your sleep. But if you naturally go to bed a little bit later and you're not working out, within a few hours of going to sleep, it usually is okay, but do what works for you. And then schedule your exercise and all of this self-care as if it's a meeting with yourself. So make sure you put it in your calendar and block out time for these things so that you make sure that it gets done. And then you want to really avoid all or nothing thinking, not just with exercise, but with all of this health and wellness information, because sometimes when we have a setback, we often think about, well, I didn't eat on my plan today, or I didn't exercise today, or I didn't meditate. And then we let that impact the rest of the choices that we make for the day. And we're like, oh, well, we'll start over tomorrow, or we'll start over next week. And, it's really about doing the next right thing, the next best decision, because you can really see, getting off track when you start to make, those cumulative decisions not to exercise or eat well or meditate or whatever it is for you. Some other things, I would say that, walking is probably the best way to get started with your wellness journey if you haven't already been exercising, because it's low impact, it's accessible, doesn't really cost anything. It really does improve digestion, and it promotes bone health and bone strength. And it really helps you maintain your activities of daily living, because being able to walk without, becoming fatigued is really, really important. And you'll see improvements in your overall health and just your energy levels if you can do that without having, to rest or to do different things to make that easier. So that's really important. And then some other things, remembering to stretch before you're even walking, especially long distances, making sure that you're using all of your muscle groups, and that you're not just focusing on your lower body or your upper body, but that you're looking at a holistic workout. Yoga outside, I think, is one of the best things that you can do for your mind and body, because you're outdoors, which has a lot of benefit. You are, incorporating some meditation into your exercise. And then yoga is really a full body exercise. So yoga done well can really be a great way to start your health and wellness journey. And then add walking in. And I think that's really the best two recommendations I could give in terms of fitness and exercise. But you do want to vary your routine up once you feel comfortable and get started with your exercise program. And you want to pace yourself. So if you're not able to do a full workout class, or you're not able to, do all of the exercises that are recommended for a particular program, know that it's okay to pace yourself and to do modifications and to start out slowly, because that's going to be sustainable over the long term. And that's what we want to see, long-term sustainable change. And then that's what's the most healthy for you mentally and physically. Some more tips are listed here. Of course, healthy snacks are important, fresh and organic foods, knowing, your risk factors and family history. And we know to limit, our alcohol consumption and tobacco use and things like that. Avoiding the fad diets, and then just really committing to healthy, sustainable change and making incremental changes is so important. And so these are just a few things to reiterate what we've discussed. And I always like to have a checklist. I feel like that's helpful when I'm thinking about making changes. Is, what is one thing I can try to do today? So these are just some ideas for you to get started. So 40 after 40, these are some healthy habits that I've put together for you. And I just want to talk about number 40, remembering that the best is yet to come. I think in a year that has been really particularly challenging for all of us, collectively, we've all, experienced the stress of 2020 and, all that COVID-19 has brought for us. Combined with just everyday stressors that didn't go away because of a pandemic, and combined with, health and lifestyle concerns, or, health and wellness concerns or challenges, so important to just celebrate where you are and to, practice that gratitude, and then to remember that the best is yet to come. It's never too late to work on a goal. It's never too late to try something new. And, oftentimes we can get in that mindset that if we haven't already done it, that it's too late. And I just want to encourage you that any change that you make that improves your health and wellness and your overall well-being is worthy, and that you have full permission to take the time that you need to really focus on yourself and to take care of yourself well. And so if you'd like this PowerPoint, you're welcome to reach out and we'll be happy to provide it for you. But I don't expect for you to be able to write all this down or remember it, but I do think these are some great habits that you can start to incorporate. And one by one, don't try to do the entire list, but pick what resonates for you and what, feels good for you, that feels like that would be a good goal, and then work toward that. So these can be some inspiration ideas for you as you start to think about goals that you have for 2021. So some special considerations as we wrap up. There are some special health concerns that you can be faced with as you age. And one of those we don't often think about is caregiving. And so caregiving is at an all-time high. It was even before the pandemic, but it certainly is now. And when you get to midlife, 40s and 50s especially, it's called the sandwich generation, regardless of what generation, millennials or Gen Z, what generation, we're talking about. It's the sandwich generation because you're often caregiving for, dependent children, maybe they're, your children, maybe their family members' children. You also are often taking care of older, older family members, maybe parents, grandparents. And so, we talk about if you find yourself caught between, trying to meet the needs of children and aging family members, usually parents, that's what it's called. It's the sandwich generation. And you can feel that stress and the obligations really start to weigh on you. And so I just wanted to take time to acknowledge that if that's the season of life that you're in, particularly right now in light of COVID-19, that we really see you and that we know that it's hard. And, it's important for you more than ever to take time for yourself, because caregiving is really difficult and it's challenging. It can be so rewarding, but it definitely is something that requires a lot of you and a lot of your time and commitment. So I just wanted to acknowledge our caregivers out there. The one thing that we can also, really be faced with is pain management. So know your limits when it comes to your workload, when it comes to you, working out, and, just know your limits. Don't lift or push or pull heavy items without help. Make sure that you're stretching and exercising, that you start out slowly. That if you hurt, go ahead and stop. So many things tell us that, that pain's good, push through the pain. But as a health and life coach, please don't push through the pain. Stop when you hurt. Try things like rest, ice, compression, and elevation. If you have like a small muscle injury, you can use over-the-counter remedies, of course. If you have pain that lasts more than a day, or two, or something is wrong, please reach out to your healthcare provider. But don't just push through the pain and ignore it, because opioid use, addiction, all of that is more prevalent now than ever before. And a lot of times it happens because of wrecks or injuries or pain management that hasn't been well controlled. And so we want to just make sure that that pain management can be a serious concern, and to always reach out for help if you need it. Inflammation and gut health is so important. Inflammation is usually the root cause of all health issues, chronic health issues like high blood pressure, high blood sugar, elevated cholesterol, triglycerides, all of that. And so inflammation could be an entire talk on its own. But if you're having health concerns, if you're waking up with, weight gain overnight of 2 or 3 pounds, if you notice that your face is really puffy after you eat certain foods, or your hands or feet swell, those could all be signs of having systemic inflammation. And a lot of times that's linked to gut health. And so I would really encourage you to look at the connection between those two things and chronic health conditions, because the management of our inflammation will be really important in avoiding some of the chronic health conditions we've talked about today. And diet and exercise and avoiding certain products and processed foods are going to be really important for you. So inflammation is going to be really key for overall health. Eye health is so important. Wear your reading glasses. Make sure that you have those in an update prescription if that's something that you need. But protecting your eyes from sun exposure is also important, especially as we age. We can usually not take quite as much damage when it comes to UV light. Wear your safety glasses when appropriate. Try to avoid eye strain. Taking breaks from electronics. Usually the rule is, every 20 minutes you need to look away from your screen at least 20 feet away, and protect yourself against blue light exposure. And make sure you're getting that annual comprehensive exam so that you can get your pupils dilated and make sure your vessel health is good, that you don't have any high ocular pressures and things like that. Hearing health, we are going to talk about, the 2020 campaign. I mentioned it earlier, but the CDC is talking about how common hearing loss is, but how much we don't know about hearing loss. And so we think about it as being something that older adults suffer with or experience, but we don't often think about how our hearing changes across our aging process. And so it's actually the third most common chronic physical condition that impacts adults in the U.S. It's more prevalent than a lot of the other diseases we've mentioned, like heart disease and diabetes and cancer, but we don't often know beyond, screenings in elementary school. We don't usually get tested. So normal hearing is 20/20. So, that's representing both ears, and that's looking at the decibels that you can hear. And so having an audiometry exam done with an audiologist is really important, particularly if you notice that you're having some issues. This is very important in the time of wearing face coverings, like I mentioned earlier. So if you've noticed that you're struggling a little bit, or you're having to get people to repeat things to you, it may be time to get a screening done at an ENT or with an audiologist to make sure that your hearing is not being impacted in some way. Hearing does change with hormonal changes, and so that's something to note as well. So you'll see people who have hearing loss, particularly if it's genetic hearing loss, it will actually typically decline as hormonal levels change. So there are about 3 to 4 times in our life where our hormonal change is pretty dramatic, and so you can see age-related hearing loss, but also hormonal-related hearing loss. And we're going to go over time just by a couple of minutes, but if you'll hang tight, we're almost done. Sun exposure, of course, we're going into the winter months, so this is not as, as necessary now, but even those who have high risk for skin cancer need to wear sunblock in the wintertime because we still do get UV light exposure. And so protecting our eyes from that exposure is really important, making sure our glasses are protecting us and that we're not just, using glasses that don't have, that protection, which are a lot of the sunglasses on the market. Using sunscreen, particularly on the left side of our body because we're typically driving a lot. So you'll often see like on the left side of your face and upper arm that you'll see a lot more skin cancers on that side because that's typically where you're getting the sun. Even when you're in the car, people don't think about that. If you're outdoors a lot, wearing protective clothing or wide brim hats can help, or garments that actually are made to protect against the sun if you do work outdoors or spend a lot of time outside. Avoiding sunlight in the 10 to 2 range because that's when the sun is going to be closest and have the most impact in terms of that radiation. And then doing regular skin checks for yourself. So when you're doing your other monthly checks, go ahead and check your skin, but make sure you have someone that can look at your back area and the backs of your legs, because things like melanoma, which is the most concerning skin cancer, a lot of times it's going to be on your neck, or it's going to be on your back, or it's going to be on your feet or other covered areas that you actually can't see. So have someone help you with that. Also check your moles, and you can use this ABCD method, and it's asymmetry, border, color, diameter, and evolution or elevation. And so if your moles are not symmetrical, if the border is uneven, if the color is really dark or it changes, if the diameter is bigger than a pencil eraser, or if the mole changes or is elevated, it's more of a risk that you might have, a risk for skin cancer with that mole, and that would be melanoma. And so that's important to check out. And then shingles, you're at a more of a risk for shingles as you age. Particularly for those who had not had the chickenpox vaccination. For those of us who had the chickenpox, which I did, we are definitely at a risk for shingles. And so that is usually stress-induced. And so that's important because we are stressed as we age, particularly with the extra responsibilities that we have and just kind of the climate that we're in right now. So it says over age 50, but I've had good friends who are very stressed who even in their mid to late 30s have seen a shingles occurrence. So that's typically going to be on the front area, just above like where your torso is, or around the backs on the back sides. So if you wore like a tank top or something, it's going to be kind of around where that band is. For women is a good point of reference. But if you see a rash that's kind of on the flanks of your back or right under on the top of your torso, that is likely shingles. And just make sure that if you see that or someone's looking at it for you, that you don't touch it, because you don't want to spread that. But if you see that kind of rash, it's very characteristic. It may not be that red, but that's very much the pattern of it. And so you want to make sure that you call the doctor, and it's usually very painful. And there are some things that they can do to help alleviate some of that pain, like creams and things like that. And of course, medications. So mental health, as we wrap up, I always want to make sure that you know that if you are feeling sad or angry or overwhelmed or just not yourself, or you're having difficulty coping, maybe you're using unhealthy coping mechanisms, maybe you have something that you're grieving, you've lost someone or something that's important to you, or you've experienced a trauma or major life event, or you've stopped doing things that you normally enjoy, you definitely want to make sure that you check in on your mental health. And there's lots of great resources here at the University of Alabama and here in the Tuscaloosa community. There's lots of avenues for help, and we just want to encourage that because our mental well-being is so important. And we know that many of us are experiencing some of these things just due to the fact that the pandemic is a little triggering for some people. And you may have experienced a particular loss this year that could be adding to that. So please do check on your mental health and that of your friends and family. And then habit change. Just in closing, things are going to take time when you start to change, your routines and your habits and your lifestyle. So just know that sustainable change is what we're aiming for. It's going to be something that you are going to see slow progress, but slow progress is still progress. And we want you to celebrate your small wins and celebrate the fact that you signed up for this class and you're wanting to make some changes. So we'd love for you to follow us on social media. I mentioned Ashley earlier. She's here on the call and she does a wonderful job of managing all of our social media. And on the blog, there are at least one blog per every class that I teach that has more information. So we would love for you to check that out. And then, of course, if you are interested in health and life coaching with me, you're welcome to email me at abby.horton@ua.edu for more information about that. Those are free sessions as a benefit as your UA employment provides. So we would love for you to have a session if that's something you're interested in. I know we're over time, so I really appreciate that y'all have stayed to the end, but I would love to open it up for questions and answers. And if you have anything, questions, comments, feedback, we would love to hear that too. I'm going to just pull up the chat. Thank you. So the recording will be on the wellness.ua.edu site later today or tomorrow. So you can get the recording. And the meditation, I just said that those were apps, and I'll type those in because sometimes that is helpful to see it. These are 3 different apps that you can use for meditation. Thanks, Jennifer. Alessandra, thank you. Sarah, thank you. Other questions that y'all might have? You cannot see the comments, okay? Let me see. Let me repost that. Can you see it now? Okay. It's listed all panelists and attendees. So I think, okay, good. I think some of you are seeing it. If not, it's Calm, Headspace, and My Life. Good. Thanks, Jennifer. Other questions, comments? Do you want the presentation sent via email? Is that what you're asking? Yes, we'll be happy to. If you'll send an email to me, to the email here on this screen, I'll be happy to send that to you. Thank you. All right. Other questions, comments? Want to make sure everyone has ample time. Okay. Well, seeing none, thanks, Candace. Seeing no other questions or comments, I just want to thank you for being here today. If you have things that come up or questions that you need answered, please feel free to email me. I'll be happy to answer those for you. I know that that was a ton of information to cover because we really just went the whole gamut of what you could explore with health and wellness. And we didn't do a deep dive into those, but just an overview. So there are some great resources in our archive webinars that go into more detail in some of those areas. So I would invite you to check those out and then really explore on your own any of those things that I mentioned. Definitely do some research and see where you want to make some changes because there's so much information out there. And there's so many resources I can direct you to if you have specific questions. So I'm just really thankful for y'all being here today, and I wish you well on your health and wellness journey. And I hope that y'all have a great break and a start to your 2021. I know it's going to be fantastic. Thanks so much, guys. Roll Tide.